Hey everybody, my name is Bailey Vi. I'm a program coordinator at the Women's Center. I use she, her, they pronouns. And today I'm going to do a presentation for you all called Let's Talk About Sex Vandy. Typically this is a pretty long presentation, so I'm going to try my best to condense it. I'm also going to be looking at two screens, so that's why I'm kind of going back and forth. But yeah, this will be just an overview of comprehensive sex education that our Vandy Sex Ed peer educators do across campus each year. So we'll go ahead and get started. So yeah, again, I'm Bailey. I use she, her, they pronouns, and I work at the Women's Center. Just to talk a little bit about the Vandy Sex Ed program. Vandy Sex Ed arms undergraduate peer educators with the knowledge and tools necessary to help both themselves and their peers make healthy and informed decisions about sex and sexuality. Vandy Sex Ed offers workshops that provide information on a range of topics related to sexuality, including birth control, contraceptives, STI prevention, as well as fostering communication skills and romantic partnerships. So again, this will be a little bit of a condensed version of our typical program, but we're going to try to hit several key points. Just a little bit of a trigger warning as well. Some topics that we'll cover might be a little bit difficult for you and things like that. And if you do find that that's the case, feel free to fast forward through the video or step away. Take care of yourself in any way that you might need. Typically, we'll ask our audience participants who here has had formal sex education. We do know that there's no federal regulations around sex education being taught in schools in the US. And so a lot of times we're either getting no sex education from our school at all, or we might be getting, especially if we live in the South, an abstinence only type of sex education. And a lot of those formats just don't cover, as comprehensive sex education as really is needed to prevent STIs, prevent unwanted pregnancies, and keep people having safe sex and making healthy decisions. So yeah, just maybe think throughout the presentation about your experience with sex education and how that kind of informs your attitude towards the subject or your approach or your knowledge base. So just to talk a little bit about our approach to sex education, we do aim to make this workshop as inclusive and comprehensive as possible, to include people of all races, genders, sexual orientations, ages, ability statuses, religions, all kinds of geographic backgrounds. And there are definitely some things that we will inevitably miss. We do ask that you get in contact with us if you think that anything should be changed or added to this presentation. We're super open to adding things because we know that we may have left some things out. We also do take a sex positive approach to sexuality education, which means that we believe that the decision to have sex should be left up to each individual, or not to have sex, right? And that we want to provide the tools necessary to make informed, healthy decisions about sex. And we're not here to tell everyone to start having sex or to stop having sex. We're just here to provide comprehensive information so that folks can make those decisions for themselves. All right. So you might kind of be wondering why it is that we do include sex in sex education. One of the reasons is just because people have all different definitions of sex, if that makes sense. And so we want to acknowledge that sex can be really broadly defined for folks. And if we think about sex, so for us, like I just said, we think about sex in a sex positive way, but also in a really expansive way. So we want to allow room for all of those definitions in the way that we educate folks. If we limit our definition of sex to just penis, vagina, penetration, then what we're doing is we're actually cutting off some of the specific information that folks might need regarding STI transmission, pregnancy risk, and things like that. So we want to make sure that we put sex in the title, and also let folks know that whatever their definition of sex is totally stands as valid. We want to include different definitions so that people can make those informed decisions, specifically when it comes to things like STI transmission and pregnancy risk. So we're going to jump right into it. Here is the diagram of a vulva. And so I would just want to throw this out there. I'm not going to go into the anatomy super in depth, but I do want to note that a lot of folks, whenever they're referring to vagina, they actually mean vulva. So the vagina is the inner part of this anatomy, and then the vulva is the outer part, which includes all of this here, which you can kind of see here on the screen. There are a lot of diagrams out there. Feel free to kind of look around. see which one makes the most sense to you. And yeah, I just want to throw that out there that whenever we say vagina, we're really meaning internal, vulva, we're meaning external. You might hear people use them interchangeably though, but they are different. So I do want to talk a little bit about the clitoris, which is here. Let me go to my notes quickly. So the glans clitoris is this top part, which is the only visible part of the clitoris. This is a really wild fact, and a lot of people don't know this, but that visible part of the clitoris actually has about 8,000 nerve endings, which makes it really, really sensitive, right? The clitoris has no other function than pleasure, which is why it can feel so pleasurable for folks to stimulate the clitoris sometimes. Yeah, and then the G-spot is what we refer to when we refer to the internal part of the clitoris. So yeah, just so you know, if you hear folks referring to that, they're talking about sort of what you can't see of the clitoris. So now we want to talk a little bit about some myths that folks might have heard about vaginas and vulvas. There are a lot of those sort of floating around out there, but we want to talk about a few of them. So one common myth is that vaginas get loose from sex, which we know is actually just biologically incorrect. So this really stems from the antiquated belief that female sexuality is amoral and that someone with a vagina is damaged after intercourse. We don't want to perpetuate those stereotypes at all. Those are just not correct. Vaginas also have elasticity. So the vagina is actually lined with a highly elastic tissue, which is supported by muscles. And during arousal, vaginas will typically expand or loosen to accommodate penetration. So the size isn't actually changing. It's just those muscles expanding and contracting. Yeah, and same thing during childbirth. Yes, of course, the muscles and the elasticity in there expands and contracts so that the child can be born. But after that, they actually normally go back to their typical size. So that's one. Yeah, the appearance and feeling of vaginas do vary from person to person. So you might hear folks like, questioning whether their vulva looks normal or something like that, or people have an idea what it's supposed to look like. But truly, every single vulva is different. Yeah, just want to throw that out there for folks. No two vaginas or no two vulvas are the same. There's another myth that really floats around out there that all people with vaginas reach orgasm from penetrative sex. Only about 7% of people with vaginas actually reach orgasm from penetration alone. Most people with vaginas require some sort of clitoral stimulation to climax. So again, that clitoris with 8,000 nerve endings, that's what typically needs to be stimulated in order for someone with a vagina, someone with a vulva to reach orgasm. That's not to say that penetration can't be pleasurable. It totally can, but just for a lot of folks, that clitoral stimulation might actually get them to orgasm. So yeah, those are a couple of myths about vaginas. Here we've got the same sort of anatomy diagram of the penis. I'll let folks kind of look at that for a second. Again, I'm not really going to go into detail for this presentation. We may be able to do some lessons around anatomy later, but yeah, so check that out. I do want to note that the head of the penis is what gets stimulated in order for orgasm to happen, but also some folks with a penis can get pleasure from the stimulation of the prostate. Not everyone, but some people. So a couple of myths about penises. Just to note, I left out some of the myths about vaginas, but we know that they are numerous. Myths about penises are a little bit less common, just because it's kind of reflective of the fact that people with vaginas' bodies have been a lot more heavily policed and regulated throughout history compared to their penis having counterparts. So you just don't hear people talk about penises in as sort of mysterious of ways as you might hear them talk about vaginas. I will say one of the biggest myths about penises is that size matters. Studies actually demonstrate that penis size has no impact on the sexual satisfaction of one's partner. People definitely have different preferences in regards to penis size. Some people do like a larger penis or a wider penis or whatever that might look like. But we know that it doesn't actually have an impact on sexual satisfaction or stimulation or anything like that. The average penis size is about 5 inches erect. So that's something that a lot of folks don't know. Again, big penises have no bearing on one's health, sexual pleasure, or reproductive reproductive capability. It's just a cultural obsession with big dicks, honestly. It's also not relative to one's testosterone or anything like that. So yeah. And just a reminder that if someone's not happy with the way that your genitals look like, you probably don't want to be sexually engaging with them anyway. So size is probably the biggest myth that we have about penises. Oh, I kind of will also say a lot of people think that erections make, like, the penis size always gets, phenomenally bigger when there's an erection present, and that's just also not true. Erections and arousal do look different from everybody with a penis. So just like folks with vaginas might not actually be very wet whenever they're aroused, people with penises can get aroused and not get an erection, get aroused and not maintain an erection, and things like that. So I just want to emphasize that as well. Awesome. And we'll take questions later on, or you feel free to email us or reach out to us with any questions that you have. Now we're going to move into contraception methods. So contraception methods are used to prevent pregnancy, and then some contraceptive methods actually will work to prevent pregnancy and STI transmission. So I'll try to touch on that difference as well. The main contraceptive method that you probably have heard of, especially if you're like me and you're from the South, is abstinence. A lot of schools like to preach abstinence only. We do know that abstinence is the only 100% effective method for contraception. But again, just like I hit on at the beginning, if you're not giving folks all options when it comes to contraception, then you're not giving them accurate information on how to best protect themselves if they do choose to engage with someone sexually. So yeah, and we also can note that places where abstinence only sex education is taught, there are actually typically higher rates of teen pregnancy and STIs. So I just want to keep that in mind as well. Okay, now I'm going to be shuffling around a little bit because I'm going to pull out some demonstrators. But yeah, we're going to talk about hormonal methods of contraception. So the first hormonal method that we talk about is the pill. Most folks have heard of birth control pills. There are a couple different kinds, but here's an example of what a pack of birth control pills might look like. You'll see the hormonal pills here, and then the placebo or the sugar pills down here. Yeah, so the pill, again, there are a couple different kinds. One is the combination pill, which releases estrogen and progestin in a combination. So one pack, just like the one I just held up, it contains 3 weeks of hormone pills and 1 week of placebo or sugar pills. Then there's also a mini pill, which it releases progestin only. It's recommended for folks that are sensitive to combo pills, and this pill must be taken at the same time every single day. That's really, really important. And so all of these pills and the hormones that they release, they basically prevent sperm and eggs from meeting. So they prevent fertilization. The way that they do that is they actually prevent the release of an egg, so they're preventing ovulation. So I just want to talk about how birth control pills work. Again, there are some other methods as well. So one is the Depo-Provera shot. I have actually a little demonstration of one here. So you can kind of see a syringe and then a little vial here. And yeah, so Depo-Provera it needs to be taken once every 12 weeks. That's super important. Depo-Provera used to be talked about as 99% effective. And if taken every 12 weeks, it is, but a lot of folks will fluctuate on that and they'll go back a couple days late or something like that. So it's super important that it is taken every 12 weeks. Let's see. There's also a ring, which looks like this. It's kind of bendy. It's called a Nuva ring. You insert this in the vagina, you take it out once a month for a week. They're about 91% effective. This is a lot of folks won't choose these rings. They're a little bit less common than some of the other methods, basically. The other one is a patch. So it looks just like this. A lot of times they'll place it on somewhere on your abdomen, your back, your upper butt area. And these are to be replaced by the user once a week. Again, that's a little bit of a less common one these days. It's a little bit of an older form of birth control. There's another one that's an implant. So you might hear this, the medical name is Implanon or Nexplanon. It's about a 2-inch long little rod that gets placed in the upper arm, so like right here. This needs to be placed by a medical professional every time. They do prevent pregnancy for up to 4 years, but you do need to go to the doctor and get them changed and get them taken out, especially if they don't work for you, which you can kind of find out based on your hormone balance pretty quickly. And if they're not working for you, you definitely need to see a medical provider to get that looked at. So just want to highlight that. All of these things you should probably talk to a medical professional before you use, most of them at least, and birth control is certainly one of those things. Okay, a couple more. So one is an IUD, which looks just like this. It's a little T-shaped plastic device, and you might hear them. Some of the hormonal ones are Skyla, Mirena, Liletta, or Kylena, and then the non-hormonal ones you'll hear they're copper IUDs. The biggest distributor is Paragard. So yeah, I will say with the IUDs, they can last 3 to 6 years depending on which one you get. Again, the non-hormonal version is a copper IUD that can last up to 12 years. All of these are 99% effective. However, there are harmful side effects if you do become pregnant and you have an IUD in. So I want to highlight that. A lot of people will choose IUDs because they're really, they're sort of like a set it and forget it type of a method, if that makes sense. So they'll be inserted by a physician, and then again, they can last 3 to 6 years, but you do need to make sure that you're constantly consulting with your doctor about those. So now we'll talk a little bit about barrier methods. I lost my place. Okay. And I have some demonstrators for these as well. So one barrier method that not a lot of folks know about is an internal condom. So it looks just like this. All condoms have expiration dates on them. This one has it right here in the middle flap. So you always want to make sure you check that before you use any condoms. But internal condoms are typically prescription only if you're going to the doctor or something like that. We do have them, however, in our office for free. So please feel free to come get one of these if you need them. They can be inserted into the vagina up to 8 hours before intercourse. So folks will choose this, again, just to kind of insert it, forget about it, and be protected. So there's that. Let me see. External condoms, I have one of those here. I have a nice Vandy Sex Ed branded one. Yeah, again, these will always have expiration dates on them. Folks will want to check those before they use them. The other thing is there's a certain, there's a way to put this on, which we're going to demonstrate here in a second. You can get these at any drugstore for the most part. Again, we do have them free in our office. The other form of protection is dental dams. Dental dams do prevent against STIs only. These are made of latex, and they're like a really thin sheet to be placed over the vulva or an anus or whatever is going to be penetrated. These are really commonly used for oral sex. But again, they only prevent against STIs. And then finger cots are the same. Those are listed here. I don't actually have one of those. That's a little bit of an older barrier method, but it would be for like digital sex with fingers. Okay, let me make sure I'm following. Okay, so then behavioral methods. There's a withdrawal method, also known as pulling out. Pulling out can be fairly effective, but it requires really intimate knowledge of your own body. So you want to make sure that you're pulling out at the exact right time before any semen is released. And the other one is a rhythm method. I have an example of these cycle beads right here, which is what a lot of folks will use to actually track their cycle. This is, again, a little bit of a more old school method. A lot of people do this now on their phone with an app. And basically you track your cycle, and then if you are trying to not become pregnant, then you will abstain from sex during the days that you're least likely to become pregnant. So again, those are for folks, a lot of folks who are using something like a natural family planning method or something like that. They may use that rhythm method, that tracking method. And then we'll move into emergency contraception. Again, I would definitely encourage folks to go ahead and consult with a doctor or a medical professional if they need one of these. These need to be used within 3 days, within 72 hours after unprotected sex. So it's basically like a higher dose of birth control. It prevents the release of an egg or fertilization from happening. So one form of emergency contraception is actually getting one of those copper IUDs that Paragard IUD put in. Again, you have to see a doctor for one of those. And then Plan B, I have a little demonstration of a Plan B pill here. With this, it's most effective for individuals up to 135 pounds. The sooner you take it after unprotected sex, the more effective it is. I will say these are pretty effective still up to, I believe 200 pounds is still something like 85% effective up to that weight. But yeah, just so you know, the sooner you take it, the more effective it is. Plan B, I believe they sell Plan B at Student Health for around $10 to $15. So make sure you go somewhere like Student Health or again to see a medical professional if you need a prescription for Plan B. Okay, let's see what else. Ella is another one, or if you need Plan B doesn't require a prescription. Ella does require a prescription. Its efficacy is consistent across people of all weights. It also does not get less effective the later you wait to take it within that 3-day window. But yeah. You don't want to use emergency contraception as the primary form of birth control. But again, if you do need them within 72 hours, consult a medical professional for those. Okay, now we're going to use an acronym called OPRA to demonstrate how to put on an external condom. So I have a demonstrator here. Let me adjust my camera just a little bit. And then I'll go ahead and open the condom. So the first step is to open. So again, you want to make sure you check that expiration date. This one's good. It lasts till 2023, so we're good. And you're going to go ahead and just tear the condom open. Most condoms have lubricant in them, so you don't want to use your mouth because you just don't. And also if you use your teeth, you might tear or rip the condom, which is really important to not do. So you open it, you're going to take it out, and then you're going to pinch the tip. I did this incorrectly the other day when I was demonstrating, so I want to do it correctly today. So you're going to see how it's kind of like a little hat right there, and you're going to pinch that tip. And then the next step is you're going to roll it. So you go to the head of the penis here. I hope that people can see that, but I'm on the head of the penis, and I roll it. Here we go. Just roll it straight down the penis like that all the way to the base. All right, so it's all the way down there to the base of the penis, and it goes all the way up. Great. Then you're going to get to your action. Whatever you're doing, go ahead and do it with the condom on. If a condom breaks during sex, you want to make sure that you stop and you wipe up anything that needs to be wiped up, and you put a new one on that's not ripped or anything like that. You cannot use a condom more than once. So that's just that. And then you want to hold the base of the penis and roll it up. I put this one so far down, and it's like in this ridge that it might not come out. Okay, yeah, it's not gonna come out. Also, my hands are all lubey, but basically you're gonna hold, you're gonna roll it up, and then you're gonna tie the condom off. I'm gonna wipe my hands. You're gonna tie it up and then dispose of it. Again, you cannot use a condom twice. Please don't try to do that. It's not recommended, not safe. Condoms are one-time use, but every time use if you want to prevent pregnancies and STIs. Okay, so now we're going to talk a little bit about sexually transmitted infections. I'm not going to go too in detail on these. We can do sort of a more specific presentation on them, but I do want to note that a lot of folks say, well, is that the same thing as an STD? It is. We call them STIs, sexually transmitted infections, just because not all infections are diseases. And then we also know that disease carries a lot of sort of negative societal stigma, but infections are, I mean, anybody can get an infection, right? Anybody can get an STI as well. So I just want to highlight that difference. So we typically will separate these when we talk about them into curable and treatable STIs. So these are the curable ones. So that means that a cure has been found for these. So these are also really common. Just so y'all know, more than half of sexually active people will get an STI at some point in their life. And this actually could be a little bit higher of a number just because some people don't actually talk about their STI status. But yeah. In half of all new cases, there are about 20 million new cases of STIs each year, and about half of all those new cases are in the 15 to 24-year-old age group. So a couple of the common curable ones: chlamydia, gonorrhea, you might also hear that one called the clap, trichomoniasis, a lot of people call it trick, pubic lice, which might be called crabs, and then syphilis. So there are a couple different strains of syphilis as well. But these, like I said, are curable, which means if you go to the doctor, you talk to them about it, they can get you on a medication quickly, hopefully, to get that cured. So make sure you talk to someone if you think that you might have any of those. We're going to talk about symptoms here in a second. But yeah, those are the curable ones. And then we'll go ahead and go to the treatable ones. Typically, we refer to these as the 4 H's just because it's easy to remember. They all start with H. So these are herpes. Which there's a lot of different strains of herpes. There's oral herpes and genital herpes, and you can actually get genital herpes from engaging with someone orally, or you can get oral herpes from engaging with someone's genitals. So it goes vice versa. Lots of people have herpes and they have no idea because it's kind of laying dormant and they don't necessarily have an outbreak, but they might carry that, that infection. So just so you know, that's, again, I kind of hinted at symptoms, but a big symptom of herpes is no symptoms at all. Yeah, HIV, which is, folks maybe know about, folks maybe don't. It is the virus that then causes AIDS. But with HIV, so again, these are treatable. I didn't mention, but herpes is treatable, so you can go get medication for that. Same with HIV. There's actually a couple different things that you can get on to prevent transmission of HIV. One is PrEP, which is pre-exposure prophylaxis. This is a medication that you take daily before sex, and it can prevent HIV transmission, again, pre-exposure, so you need to take it at the same time every day, similarly to birth control, in order to not contract HIV. And there's also PEP, which is post-exposure prophylaxis. That can be kind of compared to like an emergency contraceptive in the sense that you can get on that after you think you might have been exposed to HIV and hopefully prevent that transmission from getting on PEP. HPV, there's a vaccine for HPV. I just saw a commercial for it the other day, actually. They're recommending that folks of all genders get tested at between age 11 and 12 to prevent HPV. And the reason that you want to get that vaccine early on, and I believe it comes in 3 doses, is because HPV can cause cervical cancer. So you want to make sure that you get the vaccine for that. And then hepatitis B and C are also treatable. There are different forms of hepatitis as well. So again, with all of these, you'll still have that infection, but you want to make sure that you get on medication to treat it so that you can keep on trucking. Okay, so typically we would ask the audience how they think that STIs are transmitted. But I will just go ahead and tell you, there are 5 risky behaviors that we typically talk about. One is oral sex, anal sex, penis and vagina penetration, naked body rubbing, and sharing needles. So all of those are considered 5 risky behaviors. Again, if you use some of the barrier methods that we talked about earlier, you can hopefully avoid the transmission of STIs. Also, I want to say, okay, so some of the non-risky behaviors that we talk about are kissing, hand holding, things like that. Sexting, all of that. I do want to acknowledge the symptoms question. The most common symptom is no symptom. So we recommend that folks get tested often. You know what I mean? Some people will recommend getting tested before each new sexual encounter. That's totally fine. That's up to you. Some doctors recommend getting tested every year. Whatever it is, go ahead and get tested so that you can know your status on any of these things, because again, the most common symptom is no symptom. I really, really want to highlight that for folks. And if you do need a full STI panel, you can get that done at Student Health or at the Lentz Public Health Center, which is pretty close to campus, or at Planned Parenthood, which is also pretty close to campus. A lot of those places will do a full panel STI test for pretty reasonable price, or sometimes free of charge. I want to talk about consent quickly. We don't deal with issues of Title IX or consent or violations of consent or anything like that in our office specifically, but Project Safe does, and I'll highlight their contact information after this. But we usually use an acronym to talk about consent, so FRIES. So consent is freely given. It's not pressured, it's not manipulated, it's not forced or intoxicated, it's not coerced or anything like that. Someone should be able to soberly say, I consent to this. Consent is also reversible, so somebody who maybe is choosing to engage in something can then choose to not engage in that thing the next second, right? It can be reversed at any time. Anyone is allowed to change their mind at any time. The next thing is it's informed, so honesty about sexual health and contraceptive use. So again, we just kind of talked about that. A huge reason why you want to know your own STI status is so that you can share that with someone that you might be engaging with sexually. Because again, we know that those transmission rates are high, can be high, and so you want to make sure that you inform folks about your status. That's the honest and informing thing to do. Consent. Okay, so E is enthusiastic. Someone should be excited to engage with you sexually or to get into a hookup, anything like that. Someone should be really excited. So we want to put that in there. Enthusiasm is really important. And then consent should also be specific. So this is huge. So saying yes to one thing does not mean saying yes to everything. So just because somebody might want to be down for holding your hand and kissing one day or something like that, and you want to go a little bit further and they don't, you need to honor that because consent is specific. So again, we take questions as we go through these presentations. If you do have a question, please get in touch with us. And yeah, I believe That's it. Go ahead and follow us on Instagram and Facebook for more information. We'd love to have you check us out and check out our center and what we have going on. And this slide will highlight a few of the other resources we have here in town. So we have the Women's Center, which is listed there, the Project Safe Center, which deals with issues around consent, sexual misconduct, and Title IX. And then Student Health, which again is a great place to get STI testing, or if you have any other concerns, especially around birth control and things like that, see Student Health. The Office of Student Care Coordination, they can hook you up with several different resources on campus, including counseling services and things like that. And then Planned Parenthood of Tennessee and North Mississippi, they're big partners of ours. We love Planned Parenthood. They are located about 1.5 miles from campus, and they would be happy to help you with any of these things that we've talked about today. So yeah, thank you so much for being here, and drop us a line if you have any questions. Thanks.